Umong Sub-District Occupational Health Service in the community. Tambon Health Promoting Hospitals, or THPHs, readily provide first-level care in Thailand's public health service system. Tambon, or neighborhood communities, receive a continuing of health promotion and treatment according to need, ranging from disease prevention, diagnosis, treatment, management, and rehabilitation at different levels. THPHs promote occupational health services for seasonal and casual workers. We are delivering significant efforts to improve the safety, health, and working conditions of casual economy workers such as home workers, street vendors, workers in small construction sites, or self-sustained farmers, often in remote villages. Public health departments and related agencies help provide essential occupational health services, preventive and advisory functions. They are responsible for assisting employers, workers, and their representatives in establishing and maintaining a safe and healthy work environment, including the adaptation of work to the capabilities of workers to facilitate optimal physical and mental health. Occupational health services offered by THPHs can be organized into two main areas according to the nature of service. First, passive occupational health services is the critical assistance provided by THPH and consists of essential activities such as 1. Diagnosis or general physical examination of the patient to understand the work-related health problem and provide the best opportunity for a positive health outcome or clinical decision. 2. Provide health-related consultations for working-age adults. Engagement in farmers and Fasai clinics, as most of the people in the community are from agriculture backgrounds and employment. 4. Record and investigate the causes of work accidents, near-miss incidents, and cases of occupational diseases for reporting to regional health offices and provincial authorities to implement a proactive response. As the attending physician of Tambon Umong's THPH that focuses on occupational health services, we provide essential and standard treatments during visits. However, we also observe if the patient has an occupational or general health problem. We occasionally discover that the same health problems would arise from workers from the same occupation. If this happens, we will have a group meeting to discuss proactive projects for these groups. After the discovery of patients with occupational health problems, we will record these cases as Y96 and Y97 into the JHCIS system, Java Health Center Information System. The common health problems faced by the workers of Umong Sub-District in Lamphun are from ergonomic risk factors. Most workers are employed in peeling and processing longan fruits or dried onion bundling. Everyday situations faced include wear and tear on the body, including repetitive movements, awkward postures, being in a stationary position, direct pressure on the wrist, locked fingers, and stress placed on the thumb. Nurses collaborate with other healthcare team members to ensure optimal symptom management and provide care and support for general patients and families. For those coming for treatment at the Occupational Health Clinic, offices are open on Mondays. Primary care is given by attending physicians and doctors who work Tuesdays and Wednesdays. Patients in an emergency shall be extended immediate medical care or within 2 days get access to treatment. What is evident is that accidents and health problems can be easily prevented through self-awareness and farmer and worker health education. Health education includes pesticides, safety practices and guidelines to help reduce the risk of injuries and fatalities, such as providing practical guidance on self-care through massage, compression, and stretching techniques. The term active occupational health services means services entrusted to workers or occupational groups in the community, primarily causal workers or those who are not protected or do not have Social Security insurance. Screening and monitoring pesticide and chemical use in farms. It empowers and provides guidelines of safe practices in pesticide use to the farmers, including storage, handling, and disposal. 2. Frequent field visits, assess health risks, and recommend that workers consider their physical and mental health. After the THPH health team proactively trained communities to recognize workplace hazards and to understand control measures implemented, positive feedback is seen. Communities have improved health and fewer occupational health problems are reported. Elements of working proactively with the community are emphasized in 3 parts. 1. They are networking with partners and building trust in the community. 2. Creation of occupational health volunteers actively participating in training, building knowledge, and participating as potential health leaders. 3. Engaging businesses and entrepreneurs and raising awareness and safety activities enhance their social responsibility goals, which increase productivity and improve overall business operations. 3. Occupational health volunteers help organize and implement activities to protect workers' health by preventing and controlling occupational diseases and accidents and eliminating occupational factors and conditions hazardous to health and safety. We have trained a total of 11 people who are capable and readily assist at the THPH. Volunteers are trained to have knowledge about the basic concepts of occupational health and safety and to be community health leaders capable of transferring knowledge to workers in various occupational groups in the community. Hello, my name is Panna Salikit. I'm a villager and I have very recently become a volunteer and have been tasked with being a community health leader for the village. The doctors that came trained us on how to draw blood safely and effectively and gave us practical health literacy skills. From this, my health has improved, and now I better understand myself and adapt that knowledge for myself. Now I help my fellow neighbors and my community by performing blood tests and making recommendations for how they can change their lifestyle and eating habits and improve their hygiene. I worked at the farms and rice fields before a friend invited me to participate in the health training, and I became an occupational health volunteer. This is my 5th year volunteering, engaging with the villagers, visiting them, helping advise on how to properly care for their health, and giving suggestions on proper nutrition. I'll sometimes visit them at their homes to see if their health has improved or if there is anything we can do to help them improve their health. I am proud to have helped people gain the necessary knowledge about their health and well-being. I have the most incredible pride in myself for helping other people. Occupational health services for seasonal workers at the Umong sub-district are mostly grouped according to their occupation or field of work. The following occupational health activities introduced include 1. Health risk assessment and monitoring of occupational hazard problems through preliminary health checks for farmers. Blood cholinesterase or CHE testing evaluates potential farmer exposure to chemicals and pesticides. Establishment of a farmer and FASAI clinics at the provincial hospital to educate farmers on the importance of personal protective equipment while applying pesticides. They make recommendations to farmers on how to eliminate the risk of being affected by pesticides and protect human health by using proper PPE or personal protective equipment while applying pesticide. The Paplang Yai Umong organic vegetable farming is a large group of organic farmers who gather to promote safe and healthy agriculture. Organic fruits and vegetables are readily available and sold to customers within nearby areas. At present, Mr. Prayun Buntham is their community leader. Hi, my name is Prayun Buntham, and I'm the community leader for the Phap Plang Yai Umong organic vegetable farming here in Lamphun. Our livelihood is based on farming, and that agriculture brought us reasonable income and opportunities. We have been very fortunate for government agencies to care for us, and we believe that similar farming communities in Thailand are well treated and cared for. I would like to personally thank every organization that has supported us and what they have taught us, from upbeat and safe practices in delivering quality organic produce to supporting community economics and building relationships with local food producers. It's incredibly important, and it helps to protect the environment. The Tambon Health Promoting Hospitals provide essential occupational health services that are both reactive and proactive. The health personnel must know about occupational health and be aware of the importance of occupational health and safety. They assess the risks for workers in the community to better understand the problems and needs of workers in each occupation. They do this so that they can plan, design, and develop activities and programs to promote health and prevent and reduce the risk of illness or injury from work. Finally, they also encourage workers to behave safely at work in a safe working environment and to have a good quality of working life.